Welcome to Inflection Point Podcast, where our mantra is cultivating change from the inside out. Join your hosts, Anita Russell, Mavis Bauman, and Gail Hunter, as we create a brave space for conversations about racism, personal transformation, and accountability. Conversation provides a means to dive deeply into your thoughts, ideas, and beliefs and examine what emerges in your words, actions, and behaviors. The show is a journey towards anti-racism by cultivating change within yourself first and then out into the world. Learn to engage in racial dialogue using 4 tools: courage, conversation, relationship, and accountability. Discover how truth, reconciliation, and healing can emerge from honest and deliberate conversations. Manifest social change right now on Inflection Point Podcast. Well, hello, everyone, and welcome to the newest episode of Inflection Point Podcast. I'm your host, Anita Russell, and here's a quick hello from co-hosts Mavis and Gail.
Hi, I'm Mavis Bauman. Thanks for joining us tonight.
Hi, I'm Gail Hunter, and welcome to joining us tonight.
Thank you, Mavis and Gail. So we're going to jump right in because we have a fully packed show today. We have lots of information that we're going to be discussing. So we'll just jump right in. Today's topic is racism is a disruptor of health and wellness in mind, body, and spirit. So if you've been following us for a while, you know that we always take our topic and frame it in the form of a question. So today's question is, what are social determinants of health? So we're going to give you a quick introduction to a social determinants of health conceptual model. So I'm going to just provide a little bit of information. The resource that we are using is a 2017 publication from the National Academies of Sciences, Engineering, and Medicine. And the title of the document is Communities in Action, Pathways to Health Equity. And so I'm going to start out by reading a quote that I lifted directly from this publication, just to kind of frame up the conversation a little bit. Health equity is the state in which everyone has the opportunity to attain full health potential, and no one is disadvantaged from achieving this potential because of social position or any other socially defined circumstance. Health equity and opportunity are inextricably linked. Currently in the United States, the burdens of disease and poor health and the benefits of well-being and good health are not necessarily distributed equitably. So we're going to dig a little bit into that topic. We're going to talk somewhat about a trauma-informed care, shifting from the focus of what's wrong with you to what happened to you. A trauma-informed approach acknowledges that healthcare organizations and care teams need to have a complete picture of a patient's life situation. I want to say that again, that a trauma-informed approach to care acknowledges that healthcare organizations and care teams need to have a complete picture of a patient's life situation, their past, their present, in order to provide an effective healthcare services with a healing orientation. And we stand on the premise that trauma-informed care must be anti-racist. So we're going to present to you a model today. It's a little bit different from models that you might be used to looking at. So for example, if you're used to looking at a logic model, this is a little bit different. Logic models are usually linear and they kind of progress from inputs to outputs to outcomes. But the model that we're going to be using is circular. And because it's circular, it reflects the complexity of the topic that we're engaging in. And so when you think about a circle you have certain points that are connected to that circle. In this particular circle, it has like this outer sphere and this outer border, if you will, and that is where structural inequity, bias, and social, economic, and political drivers reside in that space. Then the innermost space of that circle is real where the social determinants of health actually lie. And we're going to talk about those social determinants. Not all, there are 9 of them. So we're not going to cover all 9 of them, but we will at least go through the list, and then we'll talk specifically about 2 of them. And sandwiched in between those 2 layers, though, are community-driven solutions, which is a really important component of this whole idea around health equity. And so at this point, I'm going to shift the conversation over to Gail, or pass the mic to Gail, I should say, and she's going to lead us in a conversation about health and well-being from that mind, body, and spirit perspective, and how critical it is for the benefit of all of us. So Gail, take it away.
Well, I think we all know that the mind, body, and spirit has been said many, many times in many different ways. But what we've realized is that looking at somebody holistically, looking at somebody from that standpoint, allows us to really explore and to know and to understand what happened, as Anita said before, not just why is somebody behaving this way, but what happened to cause them to behave this way, and what is it that's it's going to take to be able to help heal not just that individual, but the whole community, and how to change that. In this study, there are pathways to health equity stressed 6 major points. The first was health equity is crucial for the well-being and vibrancy of communities. The United States pays a high price of health inequity in lost lives, potential, and resources. Health equity is fundamental to the idea of living a good life and building a vibrant society because of its practical, economic, and civic implications, right? Shifts in economic mobility and income inequality and persisting legacies of social problems such as structural racism are hampering the attainment of health equity, causing economic loss, and most overwhelming, the loss of human lives and the human potential that has been lost with those lives. The second point that they bring up is called health is a product of multiple determinants. Well, I think we all probably know that, but the committee of the National Academies of Science, Engineering, Medicine, they took a multi-factor view of health status and health inequities. And they recognize that some of the aspects of the health status depend on individuals' behaviors and choices. But community-wide problems such as poverty, unemployment, low educational attainment, inadequate housing, lack of public transportation, exposure to violence, neighborhood deterioration, social or physical, shape health and contribute to health inequities. And the historic and ongoing interplay of structural policies, norms, and the demographic and geographic patterns also shape the life of every individual across the country, and its effects persist over multiple generations. These factors aren't intractable, and such inequities can be really mitigated by policies and community actions in some very powerful and empowering ways. The third point that they make is called communities have agency to promote health equity. However, community-based solutions are necessary, but they're not sufficient enough. What's that mean? So community is a place where one lives, works, and plays, right? It serves as that base of health that shapes our lives and behaviors. Research consistently indicates that where one lives is a greater predictor of one's health than individual characteristics or behaviors. The communities encompass multiple spheres of interaction, from the individual to the organizational level to the physical setting, and each level of interaction affects health outcomes. Communities also are unique in the nature and extent of health inequities, and so are the means to address those issues, such as the locus of power and community values that interplay to either be effective or ineffective in addressing those issues in the community. The fourth issue that they point out is supportive public and private policies at all levels and programs facilitate community action in the infrastructure policies, funding, political will, etc. And the communities across the United States are developing and putting into action strategies to reduce health inequities. Policymakers include a wide variety of actors, such as city council members, mayors, school board members, state legislatures, legislators, and federal government, whose work spans a spectrum of from the very local policy development, such as zoning, to a national policy development, such as Fair Housing Act. In addition, the policy shapes the social determinants of health and the conditions of communities. Historically, policy has arguably been a driver of health inequity. Thus, policymakers can play a significant leadership role in advancing progress in communities toward health equity or inequity. And so it's not just about the community. The community also does need people at the different levels of legislature. The fifth point they make is the collaboration and engagement of new and diverse multi-sector partners and essential to promoting health equity. So with previously established relationships, public health agencies are also natural conveners of certain health equity stakeholders, including healthcare systems, community organizations, and even the health insurance companies. Partnerships are needed to successfully address the social, economic, and environmental factors influencing the health equity. Public health agencies can connect to community development organizations, even faith-based organizations, businesses, and government agencies such as transportation, housing, education, busing, and so forth. The capacity of public health agencies as data repositories could be enhanced if more data were actually available and stratified by neighborhood levels for the specific populations and health-related indicators. And if agencies could obtain that data from a range of public and private sectors, sources, analyze it and share it with the partners and users in the community, it would, in a timely manner, it could also be very effective in creating and participating in a change. Their last point that they make, the sixth one, is tools and other resources exist to translate knowledge into action to promote health equity. Promoting health equity in communities must include many elements: creating a shared vision and building trust in a community, leadership development, building a diverse network of partners through relationship building and mutual accountability and transparency, governing processes that have a grassroots component, fostering creativity, leveraging resources, and training and commissioning technical expertise whenever it's necessary. To succeed, communities need evidence from the research, a broader context of policy, resources, and political will that nurtures those local efforts. Although no recipe for successful collaboration to promote healthy equity exists, some additional characteristics emerging from the literature and community-based practices suggest that leverage existing efforts whenever possible to make sure that you do that, to adopt also explicit strategies for authentic community engagement and ownership, involvement, and input through all stages of such efforts. Nurturing the next generation of leadership is huge and very crucial. That's the youth, and there's many possibilities and programs that are needed to be implemented for the youth that are one day going to be our leaders. Fostering flexibility and creativity and resiliency whenever it's possible. We all have heard the term resiliency, and people that experience even trauma or violence are able to develop resiliency. And sometimes it just takes one person, one adult to one youth, to just notice them and just say, I see you, and tell me what happened, right? Seriously, they also want you to consider potential community partners, including non-traditional ones, and commit, obviously, to results of systemic learning, cross-boundary collaboration, and capacity building and sustainability are all what they're recommending. And to also partner with health agencies whenever possible. There are systemic root causes of health inequities in this country that can seem overwhelming to local communities working to tackle unemployment, concentrated poverty, and school dropouts. It will take considerable time to address these root causes, and it will require system-level changes to reduce poverty, eliminate structural racism, and improve income equality, and increase educational opportunities, and fix the laws at the state and local governments and or institutions and other community residents have the power to change this narrative and help promote health equity. Although the report focuses on community-based solutions where possible, promising strategies to address these hard to tackle root causes at higher levels needs to be provided, including the policy context and the supportive actions of the partners that they are working with. It's going to take a lot, but it's possible. And there are communities that are already existing in the United States that have already made some transformations, which is
absolutely, Gail. Thank you so much for that. Was just a wealth of information. The things that really jump out at me, particularly within the context of the work that the kind of work that we do, the three of us independently, as well as what we do together, is the collaboration and engagement part of new and diverse partners are essential to meeting this goal of promoting health equity and the tools and resources to transfer that knowledge into action. Because if we have the knowledge, but we don't have the action, we don't get anywhere.
Mm-hmm. Right. And change does not happen unless there's awareness and acting on that awareness. So we have to have that action.
Absolutely. So thank you, Gail. That was amazing. I really appreciate all the information you provided. So we're going to move on to the next portion of our discussion, which is acknowledging the fact that health and wellness is, in fact, a product of multiple determinants. So it isn't just one thing, it's a combination of these things. And the document that I mentioned earlier, the Communities in Action, Pathways to Health Equity, defines 9 specific social determinants of health. So I'm going to run through the list, and then Mavis is going to take us into a discussion of one particular social determinant. So the 9 are physical health, public safety, social environment, transportation, education, employment, health systems and services, housing, income, and wealth. And then there's a quote that I want to read. The social determinants of health, while interdependent and complex, are made up of mutable factors that shape the conditions in which one lives, learns, works, plays, worship, and ages, as Gail had mentioned. So at this point, Mavis is going to lead us in a discussion with a focus on health systems and services.
Okay. I'm just absorbing a lot of what you've both said and just how big the problems are and how racism is the substrate for everything. That there is this, because of racism and other things probably, there's just unequal access to healthcare. When I was a young teenager and I had drama in my life, my mom would say, "Oh, you've got your health. Don't worry about anything." And it made me so mad. It is so true. If you don't have your health, you can't work, you can't travel, you can't relate. There's a whole cascade of things that we all know. So the whole idea of health here, to me, seems like a major place to start. I've got a quote here from an article published in the Dove Press Journal of Healthcare and Leadership. And the title of the article was Health Inequalities During COVID-19 and Their Effects on Morbidity and Mortality. So here's the quote. "Inequalities in health have existed for many decades and have led to unjust consequences in morbidity and mortality. These have become even more apparent during the COVID-19 pandemic, with individuals from Black and minority ethnic groups, poorer socioeconomic backgrounds, urban and rurally deprived locations, and vulnerable groups of society suffering the full force of its effects." I think we've all just kind of absorbed a lot about who was more at risk during COVID-19, which racial groups were dying at a faster rate, and the idea of comorbidities in certain racial groups. For example, obesity. I saw this article. This was before we started our podcast together. But this is a New York Times article where a woman, a Dr. Sabrina Strings, was in the office, and someone asked her, why are Black people sick? And she said, my answer was swift and unequivocal: slavery. Now, let's just sit with this a second, because so many things go back to slavery. But, you know, we know from things that we've read and absorbed that trauma changes our genetics over time. And this is just another example. But she further explains, she says, what I meant was the era of slavery was when white Americans determined that Black Americans needed only the bare necessities, not enough to keep them optimally safe and healthy. It set in motion Black people's diminished access to healthy foods, safe working conditions, medical treatment, and a host of other inequities that negatively impact health. So this whole idea of obesity and people, I don't know if it's news organizations so much, or maybe some scientists connecting that with obesity and COVID-19 rate of death is not scientifically proven. A lot of other ethnic groups are plenty obese. You know, we have this problem in the United States. So what that became was a distraction from what was really happening. The article goes on to talk about the distrust of the medical system by Black people and the hesitation to go to the doctor and find out what was going on. I found something else. These are both back in May of 2020. This woman writes about how her brother wasn't feeling well. He had a bad cough, and but he didn't want to go to the doctor. So he finally saw someone at an urgent care, but they didn't test him for COVID, just told him to quarantine. And a week later, his family found him dead in the basement. And she says, if he had been a middle-aged white woman, would they have turned her away? That to me is just so powerful. It just screams the inequity that people of brown skin are facing. For many Black families, mourning coronavirus deaths brings an added burden as they wonder whether racial bias may have played a role. Decades of research show that Black patients receive inferior medical care to whites. So, you know, this is something I didn't hear anything about for most of my life until, you know, even a few years ago, a friend of mine became very ill, a young woman in a Chicago, single woman, working for a nonprofit, giving her soul for to improve the world. She has a gallbladder attack, and she wrote down a lot of the details because she was afraid she would not survive. She typed them into her phone, and she wanted her daughter to know what might happen. She's an African-American woman. She came into the hospital at 3 p.m. and was diagnosed at almost 5 in the morning. She had surgery during the night, was not given any pain meds for 6 hours. And then finally, a doctor came in at 7 a.m. and said she should have asked for it. She'd been asking all night long. And then she was dismissed. And, you know, she and I talked about this, and I was just horrified. I couldn't imagine, you know, someone being treated like that. In my life, there would be a lot of advocates who would help speak for me. But this poor young woman screamed for it and, you know, then was sent home. I asked her, what was the major thing that was against her? I said, was it because you were Black? It was a county hospital. She had no insurance and she was Black. And this to me seems like a theme around the planet, that some lives are worth more than others. And I've got more to say about that later, but this is just horrifying that health policy isn't really about everybody. it's about a cost benefit analysis, you know, for where the money lies, for the color of the skin, for the economics of the people who are sick, and so on. So that's just so humbling to me, frightening, and it, you know, certainly needs to be addressed. Any questions, ladies? Anything that I raised?
Well, I just wanted to comment. You guys have heard me say this before, that this is one of those issues that kind of gets swept under the rug. You want to just keep sweeping. But what COVID-19 revealed is that when you do that, you just end up with a dirty, lumpy rug, because you're not making the issues go away. You're not making the causes go away. You're not making the outcomes go away. You're just hiding from them. And I think one of the things that I appreciate about the way you shaped up your discussion is that you sort of indicated that there are things that people don't know that they don't know. You hear me say that all the time. So many people don't even know what they don't know. And because of that, it just becomes so easy to continue to monolithically define Black people. But it gets really dangerous when you're doing that in a healthcare environment, like her not getting pain medication and things of that nature, us, you know, not really being able to feel pain, and, you know, just different things like that. These stereotypes that are literally built into our healthcare system. So I just wanted to kind of make that comment. We got about 2 more minutes before we go on break. So Gail, did you have anything that you wanted to add?
I mean, it just always, as much as I know that that is existing and has existed, it's so absurd to think that any human being, whatever color his skin is not going to feel pain. And I'm sure that in that community hospital, if somebody came in that was white and that didn't have insurance, I can't imagine that they would have been treated that way. And that's where the racism is still so, I mean, you can just see it, it's palpable. And that's at that level must change at so many other levels too. But that's certainly one level that we must.
I think about putting me side by side with my friend and imagining that she wouldn't be cared for.
Right.
And it's just heartbreaking. To me, we are totally equal in terms of our humanity and our suffering, our ability to suffer, not having money. I mean, why is access to healthcare so stratified? It is totally inhumane. It's completely inhumane.
And completely unacceptable.
Unacceptable.
Yeah, so we're going to take a quick break, and then when we come back, we'll continue the conversation. So welcome back to our show. You are listening to Inflection Point podcast on Transformation Talk Radio. And our topic for this evening is racism is a disruptor of health and wellness. And our central question is, what are social determinants of health? So I went through the whole entire list. Mavis just got finished talking about the health systems and services. I'm going to move into the social determinant, I should say, of public safety. So I'm going to start out by reading the definition according to the Communities in Action document that we've been referring to. So public safety refers to the safety and protection of the public, and it is often characterized as the absence of violence in public settings. Violent victimization affects health by causing psychological and physical injury, which can lead to disability and in some cases premature death. The perception of safety is a key indicator of violence in a community that is associated with health. There is research that suggests that perceived danger and the fear of violence can influence stress, substance use, anxiety, anger, and feelings of insecurity, all of which compromise the psychological well-being of individuals as well as communities. So public safety kind of involves looking at violence, child abuse and neglect, hate crimes, the criminal justice system, school to prison pipeline, law enforcement, adultification bias, social justice. There's a whole entire gamut of things that are directly related to this issue of public safety. And the one thing that I can say is that everybody, no matter where you live, no matter what the color of your skin is, no matter what your socioeconomic status is, you should feel safe in your community.
Mhm.
And so I want to share with you, I know you may have heard the story of a little girl. This is back in 2019. Her name is Akaya Roll. And she was a 6-year-old little girl who was arrested by a school resource officer. So the way the story played out is that she essentially, she's 6 years old, she's like in first grade, she threw a temper tantrum. Now, back in my day, when you're in school and your teacher threw, or you threw a temper tantrum as a little kid, the police were never involved. The teacher would generally just try to calm you down, try to get you to a better place, and call your parents if it just got a little bit too out of hand or whatever, and they felt like there was a need for a different type of intervention to de-escalate the situation, they would call your parents. But in 2021, well, this story happened in 2019, in the 21st century, there's an option there to call the police on little kids, little 6-year-old children. And so when you think about that, and I've seen the video, I've actually seen 2 videos connected with this story. One of them was the video of the little girl being arrested. And it's a full video, full visual, full audio, and you can hear her begging them not to arrest her, not to take her to the police station, just not, she's a 6-year-old kid. And the police officer is just like, oh, well, you have to go because you were misbehaving and all of that. She's handcuffed with zip ties as he is literally walking her to the car to put her inside the car, get her to the police station.
Mhm.
And she's such a little thing that they actually had to put her on a step stool in order to be able to take her mugshot. And then she was fingerprinted. So in the meantime, they did get around to calling, it was her grandmother. Her caregiver was her grandmother. And of course, her grandmother is in shock when she finds out that this little girl, her grandchild has been arrested and fingerprinted and had a mugshot taken. I mean, when I look at that and just think about that, it makes me just wonder, like, where are we right now in our society that we think it's okay to arrest a 6-year-old child because they threw a temper tantrum? And then one of the things that was revealed is that this was a little girl that suffered from sleep apnea. And so I did a little bit of research looking at sleep apnea in children. And one of the things that it talks about is, you know, they're sleep deprived, number one. So anybody who has children, you know what your children look like when they are tired and they are sleepy and they become cranky and they just, you know, just kind of wailing and crying. Olivia, the younger of my 2 daughters, I had an experience once with her when she threw a fit. I don't know what was wrong with her, and she literally bit me on my arm. So can you imagine if the course of action that I had taken would have been to call the police and have my daughter arrested? Like, I can't even like put those 2 things together. And so I did look at this thing called sleep apnea and how it shows up in children, and the behavior that she was exhibiting is associated with a child who has sleep apnea. But nobody asked about that. It wasn't until after the fact that this came to light. That's number one. The second thing that I wanted to point out about this story is I read a follow-up article and watched a follow-up video. And in both of them, it's talking about the outcome of that experience, how she was traumatized by that experience. Her demeanor changed.
Yeah.
Who she was as a little girl. Now, Gail, I know that you know how trauma can alter the brain, particularly of little children when their brains are just now beginning to develop. And when they have a traumatic experience, what that can do to them. She's been diagnosed with PTSD. And so, Gail, if you could speak to that a little bit, because I know we were in a workshop the other day when you passed around the diagram showing the changes in the brain patterns and things like that. So if you wouldn't mind speaking to that, that would be great.
Sure. I mean, what happened for her is that that terror that she had to have felt, and she had to have felt terrified. Any child or even an adult might have felt terrified if that really occurred and they really hadn't done anything. But the part of the brain that gets activated is that reptilian part of our brain, that the amygdala that is for the fight, flight, or freeze. And children go into freeze mode. So this may have been a very vibrant, active child, but after this trauma, she would have been very withdrawn, probably. She probably would have been very socially isolating. She wouldn't have felt safe in many places that she, especially school. I'm sure that it had to affect her performance at school. I don't know if they had to go back to the same school or not, but she wouldn't have felt safe. How could she possibly feel safe? And if I can't feel safe, it's like when a child's being abused by a parent and I can't feel safe with that parent, then the whole world doesn't feel safe to me.
Mm-hmm.
And so when a child's abused in that way by police and the school system, what's that child going to believe? And their brain's always going to have that memory, that awareness. And so different things can trigger it. Yeah.
Exactly.
Sure.
So can you speak also a little bit to the fact that she was eventually diagnosed with PTSD?
Of course. Yeah, PTSD is if there were symptoms for continuing after 6 months, then they consider it PTSD instead of acute stress disorder. And so she could have had nightmares, she could have had flashbacks, she could have had all kinds of different symptoms that usually occur with PTSD. And that she obviously exhibited that. And so they diagnosed her with it. And it was because of that incident and what happened, which is, I mean, it just is it's appalling to me that any adult would do that to a child, especially in a school system.
Right.
And it's just, it's tragic. Yeah, it really
I
is.
want to know what police program says
Right.
you can teach a child by terrorizing them.
Right.
How can they
Instant
think
program.
that would be effective?
Right.
You know, she never was the same.
No, she couldn't have been.
She couldn't have been. That will be there forever. Yeah.
The security officer, the police, the police station, they represent a community to her, right? And so she's not going to feel unsafe at school, but she's not going to feel safe out there in the public and in the world, right? Because that was not what she learned, that wasn't a safe place to be.
So when you look at that within the context of what we're talking about with these social determinants of health,
right,
you can see how that experience shifted something in her, and that whole idea of, if you look at it through that lens of public safety and being safe in school, feeling safe in school, and all of that was literally robbed from her.
Completely.
And now she's in a different kind of situation. So when I was putting all of this stuff together, one of the things that there were a couple of things that I started looking at. So I looked at some of the police practices that have been very problematic when it comes to Black and Brown communities. And the one that really, really jumps out at me was the whole stop and frisk. So stop and frisk literally, at least in terms of how I'm familiar with it in the city of New York, is it played out in Black and brown communities, people just literally being stopped, searched, frisked, sometimes just for walking down the street, or sometimes just for being in a group together. So this idea that when Black and brown people are walking down the street together in a group, or if they're just hanging out on the stoop, there's sometimes this association that they might be up to no good. So we're just going to stop them and frisk them to see if they are up to no good. And the other thing about stop and frisk that I think really, really compromise from a social determinants of health perspective is when you tie that with arrest quotas. Like, it just doesn't make sense to me that if you're a police officer, that part of what you're doing should be associated with meeting a quota of arrests. See, that just doesn't compute to me, because the bottom line is, if you're talking about public safety and the idea that people can just walk about, you know, in their community, other communities, and they just feel safe. Like we talk about Cairo, if you remember the video, he's just walking down the street, enjoying the fact that he's alive, and that sort of thing. And if crime is going down, because I've also read statistics where crime was going down. So if crime is going down, why do you have this policy in place where you want to increase your arrest, or even put these arrest quotas in place? Because now, to me, my personal opinion, you've shifted your mandate from creating a public safety environment to quotas. Like, I have to arrest whatever the number is, I have to arrest 50 people. So doesn't it come this point where you're now looking for crime, and now behaviors, you're policing behaviors and just different things like that. So it just always, when I look at all of these things and put them together in terms of everyday people just walking around and enjoying their lives and all of that, and then you have this added thing put on top of me, that because my skin looks a certain way, that there's a potential that I'm probably doing something criminally related.
And you know what that makes me think of? Remember when Kyle was saying, Kyle Williams from A Long Talk, he described how if kids were together and the cops came, he ran to save his life, because he knew he would be stuck in the system, even if he hadn't done anything, because there's not the resources to defend yourself. So you've got the trauma being, stop and frisked. You haven't done anything. And if you run or try to resist, you're in the system. You're in the system and you're just being alive.
Right. And trying to stay alive. So
and trying to stay alive.
I'm glad you said that, being alive, because one of the issues that I've heard police officers, like I've literally sat down across the table from police officers and had conversations where they said, well, I want to get home every night.
Yeah.
So do we.
Yeah. So yeah.
Like I'm pretty sure Trayvon Martin's parents wanted him to get home after he went to the store. I'm pretty sure Tamir Rice, when he was playing out in front of the community center, his parents expected him to be able to come home. Everybody wants to go home and get home. Little children want their fathers and their mothers to come home safely every night. So I've always looked at that. Or, the very common thing is, I feared for my life. I fear for my life too.
Yeah.
Trayvon Martin feared for his life. Breonna Taylor, George Floyd. Why do we not get to fear for our lives?
Right.
You see?
Yeah.
And so all of this stuff comes together. and creates this idea of public safety.
Exactly.
And affects health.
Yeah, absolutely.
Mm-hmm.
Absolutely.
Yeah, the stress alone. Mm.
Yeah, so one of the things that I found that was good about all of this was this idea of community policing. Now, like I said, I've talked to police officers. I've had the opportunity to interview police officers who are involved. This is like when I was doing some other stuff, when I was doing my television show and all of that, and they're involved in community policing, which is a different way of policing. It's getting people involved in the community. And one of the sort of agencies, if you will, is clergy, getting the church community involved. And so now there's a different type of conversation that's happening between police officers and community under the community policing. But at the same time, they both told me that community policing is very difficult to try to hold that together because there are so many forces out there that want to keep us on the same path, that same sort of destructive path that we're on, that inequitable path that we've been on. Okay, so let's think about what is it that we want the audience to walk away with. We've been talking a lot about this health equity and our time is winding down. So I wanted to think about some of the, so I wanted to read another quote. Based on its review of evidence, the committee, this is referring back to the Communities in Action resource that we've been quoting, concludes that health inequities are the result of more than just individual choice or random occurrence. They are the result of the historic and ongoing interplay. See, I love the language that they're using. The interplay of inequitable structures, policies, and norms that shape our lives. And so I wanted to give, I think we're poised to give each of us like an example of some of the community-driven solutions that are kind of out there. And one of them that I came upon was the Cure the Violence health model. And this is a school of thought where scholars and practitioners kind of make the suggestion that real and lasting progress in the fight against gun violence requires changing the social norms and attitudes that perpetuate violence and the use of guns. And so they kind of take this idea of treating gun violence as like this communicable disease where, it's got a cause. And if we can remedy the cause, if we could treat the cause and treat the symptoms, we can turn things around. So that's one example of these community-driven solutions. And I believe Gail and Mavis each have an example as well. So let's start with Gail.
Yeah, the one I came up with it's called Blueprint for Action Preventing Violence in Minneapolis. And violent crime, they targeted 4 prioritized neighborhoods. And once they implemented this program, violent crime fell by 43% in the first 2 years of the initiative. Right? And it was really based on a community and a collective program of multiple different agencies and groups working together. They had the government involved, they certainly had the police involved, but they also had, there was a transportation system that was willing to pick up youth that needed a ride to bypass the areas in the town that may have been more dangerous and that may have been more provoking for them even to get involved with. And so they would provide that service of taking them home from wherever they were to bypass that area. They also had programs that they would mentor kids, that they would provide education for kids, they would provide job training for kids. They really worked because they saw this as a public health issue. So they based it on a public health model. And what they asked, I'm going to quote this, what are we doing to get in front of the issue, not just responding afterwards? What are we doing as a city to try to prevent homicides from taking place before they take place, right?
Yeah.
Absolutely.
I think that's what,
Amen, sister.
Absolutely. Mavis?
Well, I'm going to jump quickly back to an example about health. I recommend that any listeners who are interested watch the film Bending the Arc. It's about Paul Farmer and Partners in Health. Paul Farmer and Dr. Jim Young Kim built facilities in Haiti, Peru, and in Rwanda, where, you know, I thought I might run into them at some point there. But the key message I want to bring about tonight is the simplicity of solutions sometimes. For example, in Haiti, there was a lot of tuberculosis that was not going away. They were throwing pills at them and it was not lessening. Finally, someone thought to ask, is this multi-drug resistant? Yes, it was. It was a different kind of tuberculosis. And then they said, well, it's too expensive to treat. There again, you're evaluating one life against the other. Too expensive to treat these people. Then they found the drug was off patent. And then still they had to work with the community to get them to take care of themselves. And it involved partnering the person who had tuberculosis with someone else. One partner in the community would walk to their house and say, have you taken your pills today? Do you have water to swallow that pill? It's that simple. And boom, tuberculosis fell by 80%, if I'm not mistaken. It was enormous because they were too sick often and isolated in rural areas, couldn't get to get water. So I think we need to really think creatively about these root causes and how they can be attacked at the grassroots level.
Right.
How
So we
simple
are
that is.
literally almost out of time. We have about 2 minutes left. And what I wanted to do was just call out the name again of the publication that we've been referring to. And when this shows up on YouTube and, you know, some of the other places, I will definitely make sure that that link is there. But it's a 2017 publication, the National Academies of Sciences, Engineering, and Medicine, Communities in Action, Pathways to Health Equity. That's the document. And then there's one other thing I want to call out because I know we're getting ready to get kicked off. And that is, and again, I'll make this information available, is a Harvard webinar series entitled Social Movements, Healthcare Access and Equity. Yeah, so both of those are really, really great resources. And so at this point, we're literally down to like 35 seconds or something. So I just wanted to kind of challenge people out there as they're listening to kind of go visit some of these resources, again, because you don't always know what you don't know. And these problems that we're experiencing now, they have to be solved together. And so the more of us who are able to come together and put our faith in a different future, the better off we'll be. And so, yes. And so I thank you for listening. Be sure to go and check out some of the resources that we left behind. And I think we are pretty much done at this point.
Thank you.
Thanks, everybody.
Thank you all.
Thank you for listening to Inflection Point Podcast, where our mantra is cultivating change from the inside out. The journey towards anti-racism and social change doesn't stop here. Truth, reconciliation, and healing come from ongoing, open, honest, and deliberate conversations. Continue to dive in and deconstruct your thoughts, ideas, and beliefs as we band together to manifest social change. Tune in to Inflection Point Podcast every first and third Wednesday at 3 p.m. Pacific, 6 p.m. Eastern, here on TransformationTalkRadio.com for more conversations about how we can cultivate change from the inside out.